Hi guys, my name's Bridget. I'm one of the exercise physiologists here at Vector Health. One of the most common questions that I get probably at least once a week is what actually is an exercise physiologist and what do we do? So what does our day-to-day life look like? And I guess really the big question is, what is the difference between a personal trainer or a PT and an exercise physiologist? The difference between those two things is the learning that we've had and the time that we've spent. So a PT does an online certificate 3 or 4 in fitness, and so they look at mainly just general movement patternings of the body and understanding, I guess, the basics of how to make someone strong. For myself as an exercise physiologist, I did a 4-year undergrad degree. You can also do it by doing a 3-year undergrad degree in exercise science and then going and doing a 1.5-year master's in exercise physiology. I just did the undergrad of exercise physiology. And so that gave me, I spent 4 years learning about in-depth details of the anatomy, the physiology of all of the systems within, musculoskeletal, cardiovascular, pulmonary systems, all of the different systems within our body. We then went into the applications of what, you could say, a normal person would look like, and then how our physiology or our muscles are altered when we face an injury or a disease. And then the last part of our degree, we really looked at how exercise influences and our system adapts to the prescription of exercise over time and how that can relate to someone with an injury or disease. So after 4 years, our knowledge area is exercise and exercise prescription. We understand how exercise influences different people and their physiology, and then especially then how that relates to people who have what I'd like to say altered physiology, so after an injury or after a diagnosis of a disease or anything like that, how we can then change the way that we prescribe exercise to suit that individual. One of the ways, summarizing that up, one of the best ways that I used to explain it is a doctor or a pharmacist will prescribe medications to treat an injury or a disease, and we prescribe exercise, so it's just a different means of managing a disease or an injury.